motion that was adopted at the August 6, 2014 meeting. It's motion number 08062014-5F. It relates to approving one or more of our commissions being on the directing board to the Housing for Veterans Fund. This comes from Prop 41 literature that indicates that that's where the money ultimately is going to be dispersed. We decided where it's going to be dispersed. And so, with that in mind, taking action on that motion, I'd like to send a letter to the appropriate agency, if this is not the right one, asking that one of our commissions be seated on that commission when the funds are dispersed. Mr. Lee, is there any problem with that?
I think that, I believe the request should be made to the mayor's office to send the letter from the mayor's office rather than directly from the commission.
Okay, and so let's, I think we should put that in motion form so that the record is clear that we're making a motion that the mayor's office request that one of our commissioners be appointed to the Housing for Veterans Fund as it relates to Prop 41 funds. Is that appropriate?
Yes. Yes.
That's the motion. Is there any second to that?
I'll second it.
Any discussion?
Yes, sir. How are we going to decide how the commissionary shows this to be
I think the first thing is somebody has to be willing, and if they indicate willingness, and there's hopefully more than one that's willing, we can decide out of the pool of our available willing people who would like to go. I'd like to see more than one of us on that, but I think the first thing is to find the people who really do control the purse strings for the $600 million that's dedicated to finding housing for homeless veterans. But I think that's a question that we can hold until we have approval to send somebody. Thank you. Any other further discussion? Let's take a vote on the motion. All in favor?
Aye.
Aye.
Any opposed? Motion is adopted. Okay.
Yes. Okay. So just,
I'm sorry.
just as a little update, just to let you know, the Department on Disability did send a letter regarding the use of the funds already to the Department of Housing and Community Development at the state level. And also a letter just went out, a joint letter from HCIP, the city's Housing and Community Investment Department, as well as the Housing Authority for the City of Los Angeles. They just, actually I don't know if it's actually gone out. I think it went out yesterday. But they have a letter making their request. If you want to hear, I'm sure a little bit.
Please.
Well, first of all, the draft guidelines are expected to be released at the end of October. So they put out a request for comments, and they're expecting to have what they take from that by the end of October for public review again. We already have some homeless veteran projects in the pipeline. Just as a way of background, I'll share with you that in 2007, the Housing Authority for the City of Los Angeles, as well as HCID, the Housing Department for the city, they aligned their funding to create a permanent supported housing program of Los Angeles. And since then, they've financed more than 42 permanent supporting housing and special needs housing projects, which is a total of 3,150 units targeted to homeless individuals, and they have currently 758 units in a permanent supportive housing pipeline. So that means that together the two agencies are kind of streamlining their funds to have these projects built. So what they have requested from HCD, the state level, that's actually handling the money, they have requested that a minimum of $15 million be committed to the city of Los Angeles, but that's not money that would go through this, the city government of Los Angeles. But that's money that developers who want to build within the city can use to leverage the funding through the city. So funding that the housing department already has, if they get their wish that $15 million are committed to this area within the city of Los Angeles, that would be used together with the funding they already have. And they think would fund 500 units of veterans housing within 2 years. They're also, let me read to you, and then I'll give you a little explanation. But to create flexibility for local implementation by allowing for Prop 41 funds to be used for capital and operating costs as needed within each project, similar to the Mental Health Services Act. So now, the way it's set up currently with the discussion has been is that the money is for building the actual buildings. But what they're asking for is that some of the money be used to subsidize the housing. So if people can't afford the rent, which usually they can't, even when it's built with public funds, if there are no Section 8 vouchers, that there will be some other kind of subsidy based on the Prop 41 funding that will be used to operate those buildings. So that's one of the things they're requesting. They're also requesting, I'm going to read you the words and then I'll explain, because it's not straight English, to adjust the state's residual receipts calculation to include a $4,000 per unit per year services reserve for all supported housing units that participate in the city's coordinated entry system. Let me break that down. Okay, so the coordinated entry system is not something put together by the city. It's kind of seems to be spearheaded by United Way and the Hope Corporation for Supportive Housing. But the city's been involved in discussions about how to implement it. What the coordinated entry system would be. Well, historically, there's been a problem with people with the most dire needs not getting housing because they aren't in good situation to get all their papers together to know what's being advertised where and when and get everything in. And so they've come up with a system in order to satisfy a federal mandate by which service workers will administer a questionnaire called a SPDAT, to see how badly someone needs housing, what their likelihood is of terrible things happening to them if they don't get subsidized housing. And so they don't have to wait in a long line, but when there's housing available, they're put into it. So that's coordinated entry system. So this is saying that if somebody gets into the supportive housing unit using the coordinated entry system, that up to $4,000 per year per unit can be used for the service coordinator. Before the final calculations are done, it's a way of arranging the accounting so that people can spend more money on coordinating services and less goes back to the state. Hopefully I'm not mailing this, but it's extremely complicated, but the bottom line is they need more funding for the service coordinators. So people who are living there, they need to see a therapist, they need health care. That's usually covered by either county DMH or Medi-Cal, Medicare. But the service coordinators, the on-site person who arranges the services that are needed, helps the person get there, it just kind of coordinates everything. historically, there's been very little funding for that. And so, the number somebody gave me was about 800 per unit per year, which wasn't enough to do much. And so they want to raise that to up to 4,000. I think they are spending that in helping the person get to their services. That would be taken into account when they do the calculations of what money gets owed where. I told the man to explain this to me. He explained it to me perfectly, and I explained it perfectly. It's still too complicated. So forgive me, I'm sorry, I couldn't get it completely 100% straight and clear. I'm not an accountant, but I know that most of you aren't either. But you understand the spirit of it. And so this is what's being requested. We won't know how this goes over at HCD at the state level until the end of October. So we're urging the state to deploy $600 million in veterans now. And that's about it. So any other questions for me?
Thank you. I think it would be helpful if we could, maybe in advance of the meetings, if you could.
Advance what?
Give us advance of these meetings, maybe give us a copy of some of those letters if we have them,
Okay.
so that we're not trying to learn it as you're speaking.
Yeah, I thought this morning, but okay.
Thank you.
In the spirit of learning as you speak, there were a lot of big numbers thrown around there,
Yeah.
15 million, 4,000 per unit, then there was 600 million at the end. I'm just trying to get clarity. What is 15 million set aside to be used for coordinator service, or is that something else?
No, so the 15 million is what the housing department and the housing authority have requested that the state set aside for housing projects kind of in general, for veterans, permanent supportive housing for veterans here within the city. So that money isn't money that would go through the city, but money that developers, if you're a developer, you want to start a project, you would apply to the state. And what we're asking for, what the city housing authority and the housing department are asking for, is that $15 million from Prop 41 funding be set aside for use by developers in the city for Prop 41 housing. To be used within 2 years.
That's for financing, for funding, or?
My understanding was that was the global number. That's how much of the pot will be set aside for use for housing here. But again, your question is that just for building, or is that include building and operational? Is that what you're asking?
I was trying to get an understanding of what the 15 million was set aside for, so you could explain that. Thank you.
I don't know that I have. I've told you my understanding of what's here, but it does actually beg the question, I think. But if you're
It
satisfied,
does require some follow-up
okay.
for clarity with the numbers, I think.
And the 4,000, the up to 4,000 was for service coordination. So the on-site person who helps tenants find what services they need and get there, that would be towards their services. The services provided by the service coordinator.
And that again would come out of the Prop 41 funding?
Yes, that's my understanding.
Thank you.
Thank you. We have, I'm going to bring up one issue on item number 4 before we ask for public comment. I was forwarded an article that the name of the article was the number of homeless vets sleeping on the street drops nearly 40% in 4 years. This article is on the internet, readily available, and I'm not sure that it does a service to Los Angeles, because we have evidence that indicates that although the homeless vets have diminished in Los Angeles, it's not 40%, it's about 23%. So I just want to have clarification so that this issue is not felt to be self-fixing itself. I want to make it clear that we have a significant problem in Los Angeles, and the problem is not diminished by 40%, but 23%, and we may consider sending a letter to the author of this so that there's clarification, if not an outright ask for the data support.